Welcome to the Positive News. Today we have Natasha Lawrence from Women's Health and Women's Hands to talk to us about HIV testing in Ontario. Natasha, welcome to the Positive News.
Thank you so much for having me.
Thank you for being here. Natasha is here to talk to us about the advancements in HIV testing and resources in Ontario. So Natasha, I want to ask, why is it so important to get tested for HIV?
Well, really, it's important because everyone has a status, right? Everyone is either HIV negative or HIV positive. And the only way that you can know what your status is for sure is by getting tested.
So when you think of HIV testing, we think about going to our family physicians and going to a clinic and getting blood drawn, but there's so many available options that a lot of people don't know about. Can you talk to us about community testing?
Yeah, so community testing is when you go out to different community settings and provide testing, usually in the form of the rapid point of care test, which is a finger prick test that gives you your results in a few minutes. And this testing can be done in a variety of different settings, such as festivals. And you could also utilize different testing strategies, such as the HIV self-testing kit, which is very similar to the rapid point of care test, but it's one that you can operate on your own.
Why is it so important to have that community support?
Well, there's still a lot of stigma around HIV and a lot of discrimination. So the more education and the more awareness that we can bring to the community, as well as a variety of different options when it comes to accessing testing, the better. It will really help to dispel myths and stigma around HIV.
Who should be getting tested?
So there are groups called priority populations who may be at an increased risk of HIV transmission. Those groups are people within the African, Caribbean, and Black community, people within Indigenous communities, gay, bi, and men who have sex with men. Also, folks who may inject substances. Women are also at an increased risk who fall within these priority populations due to unique factors such as gender-based violence, sexism, and/or racism.
And why is early detection so important?
Well, with early detection, you get better health outcomes. You can get on treatment sooner. And for folks who are living with HIV and are on treatment are living very long and healthy lives. It also acts as a prevention method as well, too, when it comes to U equals U, which stands for undetectable equals untransmittable, which basically means that someone living with HIV on treatment can get an undetectable viral load, and that way they wouldn't be able to transmit the virus on to somebody else.
What resources are available for those who test positive?
So for folks who test positive, they can access a variety of different resources. My organization, for example, Women's Health and Women's Hands, provides wraparound support such as primary healthcare services, mental health services, social supports, and other external referrals that folks may need. There's also a variety of AIDS service organizations located across Ontario to get access to a variety of different resources and supports.
What resources are available if you test negative?
So there's a lot of great HIV prevention projects and programs that are available for folks who test negative so that they can continue to stay up to date on their status. They can get resources to safer sex tools such as condoms and lube, and they can get education on HIV, which would help to keep them in a negative status.
You really have brought us some positive news when it comes to HIV testing. Thank you for being here today.
Thank you.
And for those of you at home, stay tuned to PositiveNews.ca for more positive news.